There was a 75-page announcement this week of substance abuse and mental health services by the Substance Abuse and Mental Health Services Administration, where they've pledged $30 million in harm reduction program. It's a grant which includes a list of required harm reduction activities. This is the Biden administration, and the monies must be used for the purchase of, quote, equipment and supplies to enhance harm reduction efforts, such as safe smoking kits, supplies. So that got turned into Joe Biden's administration is putting $30 million towards giving out crack vials or heroin needles or what have you, safe needles. You did you read this the harm reduction grant that's
Yeah,
being.
yeah. So this is one of the things that that worries me about this. This is precisely what I'm talking about. So we put money into these sorts of things, which is it's fine. We want to make sure people stay safe. We want to reduce the harms. That's absolutely fine. But if you're not talking about having these drug checking facilities, making sure that people can test for contaminants in their substances, it's not going to do anything to deal with this issue of people dying from overdoses. And that's the major problem. And this is what Spain has done, the Netherlands, Switzerland. I just got back from Switzerland, where I've been spending most of my time these days. Places like that where the first thing they want to do is just make sure that their citizens are safe. And this here sort of proposal doesn't even mention that kind of thing. And it's well known within the field around the world. And it just blows my mind. A country that ignores this basic sort of safety procedure, that's a sick country. I can't believe how this is happening in my time. If people read the book and they see, and people know I've been advocating for this, and then we see what other countries have done and they don't have this problem, this is an easy fix. And I just don't understand it.
We're talking with Dr. Carl Hart. You can follow him at Dr. Carl Hart, 1L, 1T on the Twitters. The book is called Drug Use for Grownups. I am completely anti-drugs personally. I wish that everyone would also be. That's my wish, because I just feel like working in a sober environment and not dependent on anything to do the things we need to do is, to me, ideal. But I'm not judging anybody. You do what you do. That's how I roll. It's what I would like to see. Even alcohol. I was listening today to Heather B Live. Tramel was filling in. I'll call her T Mac. And she read a study. There's a study about alcohol and what it does to the brain immediately, and because it's absorbed right into your system. And this actor named AJ, you might have seen him in the Friday movie. He died last year. We did a whole thing, in memoriam, and it found out that he actually died from alcohol, even though natural causes was the cause of death, natural causes. But what they found in his tissue, even though it was no alcohol in his system at the time that he died, but it was in his body. It was in his body. And that was the overuse of alcohol was the cause, the actual thing that led to him dying.
Karen, can I say something about
Yeah, I was
this
going to ask you,
alcohol?
what are your thoughts on alcohol? Because I never talked to you
Yeah.
about
So one
alcohol.
of the things that I see in movies and these things is like, well, people who had an alcohol problem, they drank heavily, and then their family members or friends, and they say, you got to quit cold turkey. You got to, quit. And so people feel like they got to do it because otherwise they're a failure, because they want to improve, or they want to make sure that they do right by their family members. But the concern that I have is when people are advocating that folks who've been using alcohol chronically, that's for a long time, and then you abruptly discontinue your alcohol use, now you run the risk of dying from alcohol withdrawal. And of all the drugs that we talk about, heroin, cocaine, methamphetamine, cannabis, none of those other drugs can healthy people die from withdrawal. But with alcohol, they can die from withdrawal. So I just want to caution people that
Mm-hmm.
if you have an alcohol problem, please do not abruptly discontinue, especially without medical assistance, because then you run the risk of harming yourself. So if you want to
And
stop,
and it,
get help there.
I think that was the case. AJ Johnson, the autopsy revealed he died from chronic ethanol use, which is he died from alcohol abuse, but there was no alcohol or drugs in his system at the time of his death. So it must have been him quitting in the way that you're saying. So what's the best way, if you are a 6 pack a day, drinker, do you take, do you cut back one beer a day? Or if you have a whole bottle of wine, do you do 3 glass? Like what's the weaning process?
Yeah, it'd be better if the person is able to seek medical attention, because then they don't necessarily have to drink alcohol. They can do something like a benzodiazepine and then just have a taper off, and then that will be a much safer environment than trying to wean themselves off of alcohol if they've been using for some extended period of time. And so because alcohol, just a quick lesson, alcohol, this thing we call half-life, that is how long it takes the body to get rid of half of the drug. Well, alcohol, the half-life is like an hour. It's really quick. And so it's like it leaves the body quickly. And if you want to like detoxify or slowly wean yourself off, alcohol is not the drug to do it. That's why you'll need something like a benzodiazepine, which has a longer half-life, and it allows the body to slowly adjust to not having the substance in the body. And so I can't stress that enough, because the number of people die every year from just abruptly discontinuing their alcohol use, and that's dangerous.
Question, Dr. Carl. I've heard it said that alcoholism is a progressive disease and that cigarette smoking is a progressive disease. And so that if you stop for a period of time and you start later, you pick up as if there had been no break. What does that even mean? Or is that not correct at all?
That's not correct. I don't know. We think about this thing called tolerance. If you've been using a drug for some period of time, it may now require you to take more of the drug to have an effect. That's the thing we call tolerance. But if you stop, cut your drug use back, you can lose that tolerance, and now you don't need to use as much. So this notion is of like, if you stop and then you're right back where you started from, that just simply it's some mythology that somebody is promoting, but that's not how the body works.
Got it. So here's my other thing. Sugar is like, to me, the worst drug in the world. I am a sugar addict. I consider it an alcoholism because alcohol turns to sugar. Like, what can I do? Is there some benzodiazepine for me and my sugar addiction?
Yes.
That's a good one, because that me too. I love my sugar, and I have a sugar problem. And the best thing I try to do is just be more disciplined. Like write down how much I'm taking, and then and I compare the data, and having the data face me, and then I realize that I'm 55 now, and so I don't want to be having issues related to diabetes, and so the data frightens me enough so I can scale back when I'm disciplined. That is writing things down, and that's the best thing that I do for my sugar.
Wow. And then this was for you, Karen.
Wait, but look, how much of a scientist is he that he writes down his sugar and then he compares the data? All right, go ahead, Tonya. I love it.
I love that you talked about the word drug. And so I looked up the word drug, and it said it's a medicine or other substance which has a physiological effect when ingested or otherwise introduced into the body. And so when I started thinking about the word drug, pretty much everything is a drug. I mean, salt is a drug. People take turmeric. That's a drug. Ginger, it's a drug.
Some people think of drug as like one exception to that. The definition is just that like the body doesn't need it to survive. And so when we think about salt and the sugars and those things, we need those to survive. And so it depends on who's defining drug, but you're right. And so the person who's defining it kind of sets the rules about that.
For me, it's anything that alters your cognitive abilities, which sugar could do, for me, it's just anything that you can be addicted to. I just don't want us to not be addicted. We're in a country and a culture that plays with our addictions, that actually, informs our addictions, that feeds our addictions with the advertising, whether it's Popeye's chicken, Kentucky Fried Chicken, or liquor, which we have on every corner in certain neighborhoods. Is by design. Fast food on every corner by design. And I'm just anti all of that, because I want us to be free. And freedom means I get to make my decisions and choices based on the things that I need in my life. And I feel like a lot of us aren't making those choices, and we're not conscious either. So for me, it's just about being conscious. Do what you want. You're grown. God bless you. Live your life. It's very limited time that we have on this earth. Be happy, but I want our happiness to be rooted in our freedom. So that's just it for me,
Yeah.
Tonya. I just.
Karen, I have a one question about that. So this freedom issue, like when we talk about drugs, it's a lot more than like addiction. Addiction is just one component. Like last Thursday, for example, in Chicago, this police officer, Jason Van Dyke, got out of jail after serving about
That's
three.
the man that killed Laquan McDonald.
There we go. He killed Laquan McDonald, and he shot Laquan McDonald in October 2014. Shot him 16 times. And if people see the video, they can see Laquan McDonald was not coming at him. He was going away from this officer who kept shooting him even when he was down on the ground. Now, the officer said that Laquan McDonald was on PCP. PCP is a drug that we have said causes people to have superhuman strength. And we've said a number of things about the drug that simply isn't true. It's a drug that's almost identical to ketamine, which we use for depression and we use for other sort of things. But we made up these stories about PCP such that the press believed, and they didn't ask any questions after he said he evoked PCP. And it was a year later, we got the video to see that what the officer had said was inconsistent with what had actually happened. And so we as a public, we accept, PCP, so therefore he must have been justified. And so the way we use drugs, it allows people to scapegoat drugs for bad behavior like this. And oftentimes the people who are paying the price for that bad behavior are people who look like you and me. And so these are other issues I point out in the book. And I talked about this case, and I wanted people to understand that it's much deeper than something like addiction. This is one of the main reasons that our folks have been subjugated in this country. And that's what I'm trying to help people to understand. Move beyond the addiction frame and look at all of these other issues, and you see how this issue has been used against us.
And thanks for bringing up Jason Van Dyke, because I didn't talk about it on the airwaves because I didn't know. It's like we in the midst of Amir Locke being shot while he's under the covers in his friends or cousins' living room on the couch without any warning, 9 seconds on a no-knock warrant, that this man now gets to walk free, Jason Van Dyke, after the cover-up that followed.
And I got to tell you, the jury gave Jason Van Dyke 99 years. Now, and then the judge in that case disregarded their sentence
recommendation.
And gave him about 7 years, which he served about 3. And so those kind of issues is happening almost every day in this country surrounding drugs, and that's why I moved to Switzerland, because you're trying to ask people to like, yo, check this out. This is how we're being played, and then people are like, oh, you promoting drugs, and it's like, it ain't about that. It's about how we're being played.
You moved. You got the hell up out of Dodge.
Your family's there in Switzerland now?
Yeah, I live part-time between New York and Geneva. It's like it's too painful to watch. It's like watching a loved one die of an illness that we have the treatment for, and we're not giving the person the treatment. I can't. It's just too bad. It's too bad for my soul.
I'm same place. That's why I'm in Panama. It's too painful.
866-801-8255. Well, at least I know I got 2 places. I think Dr. Carl will let me stay with him.
Absolutely, Karen. You always welcome.
I feel like I could tip over there. All right. Ira in New Jersey. Welcome to the Karen Hunter Show. Hi.
Hi, Karen.
Hi, Ira.
I guess I can put my phone down. Okay.
All right.
I called because I'm a licensed counselor.
Okay.
Who've been working in this field over 20 years. I forgot the doctor's name.
Carl Hart.
But I do agree.
Carl Hart.
Dr. Hart?
Yes.
Okay, Dr. Hart, how are you? How's Tonya? Hi, Karen.
Hey.
This is my point. I agree that they should not stop oxycontin or whatever kind of pain medicine. They should treat the problem, the addiction, as opposed to trying to deprive people of medicine they need. That's one point. My second point is as good as that tester, that drug tester you were talking about, I believe it is, it's not practical. Most drug addicts are not going to take any bit of some drug that they bought to take a little bit and put it on a testing tube. They're not going to do that. That's not practical. I live in and I'm born and raised in the North. I've been around addiction my entire life.
Is there and thank you, Ira, and God bless your work. Dr. Hart, is there a difference between addiction and somebody that recreationally uses drugs the way you do and Michael K. Williams and others?
Yeah, but I just want to address Ira's point. Ira, there's evidence and data to show that they will do this, particularly when you take your facilities to where they're located, like many of these places do, and it becomes a part of the culture. So that's just not true. This sort of characterization of people who are addicted as being out of control. Another thing we didn't talk about is that, I've been given drugs at a place like Columbia University as part of my studies to people in some cases who are addicted. And these are some of the most responsible people that I've ever met. And they can and do inhibit under the right conditions and so forth. Now, when we think about addiction is simply people who are addicted. They're the folks who they have these psychosocial disruptions in their functioning. That is, they're not meeting their obligations, whether those obligations are at home, at work, at school. And the second part of that is that they are troubled by not meeting these obligations. So they're distressed by the fact that they have these disruptions that are caused by drugs. And then people who use drugs recreational, we can just think of anybody who uses alcohol, have a glass of wine on some evenings, or some people do cocaine like that. Some people do heroin like that. They do MDMA like that. And so the vast majority of people who use drugs fall into the category of not being addicted. They are just responsible people. And the people who are addicted, oftentimes they are addicted not because of the drug. They're addicted because of some other issue, like they have co-occurring psychiatric illnesses. They may be depressed. They may have schizophrenia. They may have anxiety. They have chronic, unrealistic expectations heaped on them. You can think about the poor young celebrity who has to take care of their entire family, and they've been doing this since they were young, very young people. They're more likely to meet criteria for addiction. People who have lost gainful employment, where they were once somebody in their communities, now they're no one, and there's no sort of possibilities that they will regain that status. All of those issues are far more important when it comes to addiction. And so when people focus exclusively on the drug, they've missed the point. They missed the boat.
Okay, I'm glad.
I also say that, the stigma of doing drugs is so strong that the majority of people who do them just ain't gonna tell you.
That's right.
That's
exactly right.
It's just gonna be quiet.
That's exactly right.
Drugs.
And that's why with Michael K. Williams, for example, and this is not to besmirch his reputation, but he certainly had said that he was not doing anything anymore because the stigma is so great and people would vilify him. We can think about Prince. We're coming up on another anniversary of his death. He had said for years that he wasn't using drugs. I mean, because again, the stigma is so great. And then the problem with that is that they don't get the information to help keep them safe. And then they may put themselves at risk by doing some risky, dangerous activity when they could have been doing it safer if people only knew.
Right.
866-801-8255. Thailand, one step closer to decriminalizing marijuana. Do you have hope, Dr. Carl Hart, with marijuana, that this administration will decriminalize marijuana federally?
Yeah, so like we should explain the difference between decriminalization and legalization. So decriminalization is basically people will not be arrested for possessing small amounts of the drug, personal use of the drug, but the drug sales remain illegal with decriminalization. And legalization is where, like with alcohol, you can legally buy it and purchase it, sell it if you are of the appropriate age. So those are the differences. Now with decriminalization, sometimes people think that's a cure-all, but it's not, because if you take Baltimore, for example, Baltimore decriminalized cannabis in 2015. If you go from 2015 to 2017, they had some data of their arrests. They arrested more than 1,500 people in the period where they decriminalized the drug. And 96% of those people were Black people, even though Black people only make up about 60% of the population in Baltimore. And so you still have in New York City, the same sort of thing happened. We decriminalized cannabis back in 1977, but Black and brown people were still being arrested for it because police still have this discretion. And decriminalization doesn't do anything really to deal with the adulterants that we are
So we need
concerned about.
legalization. We need legalization.
We need legal regulation. And that's what's happening in the States. And that's going to keep happening because people see how much money they can make. And that's the ultimate sort of test, or that's the ultimate decider of whether or not this will be legal. Whether or not those folks who've been making money in the country, who make money, can make money on the substance. That's the bottom line. It's not about justice. It's not about any of this stuff. It's about people making money.
Do you think the Biden administration is going to make marijuana legal?
No, not at the federal level. The federal government is they are not heroic. So this will come from states. I mean,
state by state. So it's going to be every state.
You know, because you can think about
New York. Arrested federally, right? If it's federal, it's still a federal crime. You can still get arrested even if you're in a state.
Yeah, absolutely. and banking is the problem. People need to. We're going to do a whole thing in a couple of Wednesdays on cannabis. Tonya, McCarthy in El Paso, Texas. I want to get as many calls as possible. McCarthy has a question for Dr. Hart. Hi.
Hello, Dr. Hart.
How you doing?
I'm doing. I thank God I'm doing fantastic.
That's great.
I've been meaning. I'm glad I turned on the radio to get to you. I had started listening to your book a little bit a few months ago. Hey, and let me ask you something. How can a person be addicted and they can get all of the drugs that they're supposed to be addicted to? Example, I take this hydrocodone that's prescribed to me by my doctor. He wants to do surgery, but I said, as long as the tablets help me, I don't need to have a surgery. So for the past, I just say my history. For the last year, I get my prescription every month. Now, would that say that I'm addicted?
Good question.
No.
All right. Thank you for your call and feel better.
As I was pointing out earlier, addiction is where people have disruptions in their functioning, their psychosocial functioning. They're not meeting their obligations and they are distressed by that. That's addiction. But if you are taking a medication prescribed to you by your physician who is monitoring your behavior and you're meeting your obligations and you're functioning and you're living a healthy life otherwise, no, that's not addiction. You can think about people who take blood pressure medication or people who take insulin for diabetes. They have to do this every day. And we don't call them addicted. As long as they are meeting their obligations and are otherwise healthy.